The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Scientists are beginning to uncover symptoms of long-haul COVID in kids. But what should parents and caretakers look for? In this episode, I speak with Dr. Chris Bethel, pediatrician at Peyton Manning's Children's Hospital. Bethel says while no patient is alike, there are common symptoms he sees in his practice. Bethel also says the anxiety and fear a child feels not knowing if they will ever be fully healthy again weighs heavily on them. We discuss what you as a parent or caretaker can do about it. Our conversation is next.
Dr. Belcher, great to see you. Thanks for hopping on. We're talking about the kids and being long haulers. So I'm just wondering, these symptoms are starting to appear as we these months have been passing. And what are these symptoms?
Yeah, it varies greatly. You know, the thing I can say about long haulers or PASC kids is there's no typical case. They're variable. So some of them, a lot of the big complaints are fatigue. Some are difficulty concentrating. Some things are chest pain or not being able to exercise. It really varies depending on the child.
Yeah, right. Every case is different depending on the child. Okay, so are these more, these are similar to adults then, but are they more severe?
Not necessarily. They are similar, but again, adults often see a variety of symptoms with it too. And it really depends on the individual. Some of them are able to resume their activities and do great in school despite the symptoms. Other ones don't.
Yeah, I'm kind of wondering. I mean, this can really affect a kid as he develops or he or she develops. The concentration, they're in school, not being able to play sports or not being able to. So these things are, I'm just wondering, how does it affect a child's quality of life?
Again, it's variable. You know, some of these kids come in with the complaints that they don't have the concentration to make it through school. They're not doing well and they're doing grades. They were very active in sports and then they're not able to. But again, that's a minority of children with COVID. We want to prevent all these, but some of them can be very seriously affected. Other kids with PASC lose their smell for months and it's disturbing. But that's as bad as it gets for them. It's completely variable.
Oh, speaking of losing taste and smell, that must be scary for a kid. I mean, scary for everybody. It's like you don't appreciate something until it's gone. And kids love sweets.
Yeah.
Not all of them again, but anyway, oh gosh. And you've also had these cases of seeing patients that are maybe less severe, less affected, and then maybe more severely affected. What is the reaction from parents and children when they come in, let's say, having a more severe or more difficult time?
Yeah, again, it can vary. A lot of it is fear. A lot of it is worrying. Am I ever going to get better? How is this going to affect me in the long run? When am I going to get back doing the things I want to do? Some children will have anxiety, real anxiety because of it. Some kids will get depressed from not being able to participate in activities. So again, it's variable. The more severe ones tend to have more problems to deal with, and it's hard on them.
And as someone who has much experience speaking with children, the language is very important. So when a child comes in and is very anxious and is sort of depressed or sad about what's happening, fearful, let's say, what is the language you use when you speak to them?
Oh, it's pediatrics. So this is a huge age range from someone who's just verbal, 3-4-year-olds into your school age kids. And then you get into your preteens and adolescents. And adolescents, you can have a very adult conversation about with this, and they may be able to express those feelings and stuff to you. A school age kid may just not know they're right and upset and have nothing to say to you about it. Again, you got to do what's appropriate based on the developmental age.
What's your message to parents? I mean, last statistics I looked at, maybe 5.5% of kids 5 to 11 are vaccinated. What is your message to parents?
Yeah, as we talk about things like the long haulers, as well as the complications of COVID, I think the most important thing you can do if you're worried about them is get your child vaccinated. Don't get COVID in the first place. So we do have vaccine now available from 5 on up. get them vaccinated if you're worried about these kind of things. COVID isn't always a benign disease. It creates a lot of pain and suffering for children.
Yeah, pain and suffering that is avoidable now that we know that we have all of these resources. And then how's everything going at Ascension?
We're doing well. We have been seeing more kids in the last several months than we had. The first year of the pandemic, we had very few children hospitalized. But we continue to see children hospitalized, not just those who have pre-existing medical conditions, but we're seeing some well children hospitalized. And really over the last few weeks, we've seen several infants hospitalized, which was unusual for us because they weren't that common earlier in the pandemic. So this story continues to evolve.
More infants. I'm wondering, how do you treat an infant who's infected?
Yeah. We don't have great treatments for COVID. It depends what brings them in. We have our steroids and some antivirals and other therapies if we need it for respiratory failure. The thing that brings infants in most commonly is fever. And for a newborn or an infant, you got to make sure there's not other infections or infections along with COVID causing it. And that's something we've done in pediatrics for a long time with other viruses as well.
Okay, so I guess I'm not aware specifically about the specific medications that you can give infants, but I imagine it's not the same dose that you'd want to give let's say an antiviral pill. Can they get that? Are they able to receive that?
Yeah. For younger children, yes, they can receive some of the treatments for COVID are approved down to birth. Certainly not all of them. For kids with respiratory illnesses, the steroid we use has a long track record in children. And that's the one that most people are comfortable with while data comes in. Just like we saw with the vaccine, things tend to get approved in adults and then move down younger and younger ages, often with an emergency use authorization before full approval.
What is that steroid?
Dexamethasone.
Oh, dexamethasone. Okay. Wow, interesting. Anything else you want to add? Such interesting stuff.
It is. Again, we're still learning about this disease and, we don't have a best treatment. There's not a one size fits all for children and adolescents who continue to experience symptoms following after COVID. So I'd encourage them, if they think they have them, go see your primary care provider, talk to them about what you have. You still need to keep your mind open that it could be something else. You don't want to miss something else. And then treat the symptoms. Go for what's ailing them to try to get them over this as quick as possible.
Mm-hmm. Wow, great stuff. And thank you for all the work that you've been doing throughout this time.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.